Ko e ngā mana, e ngā reo, e ngā karangatanga maha o tua, tēnā koutou, tēnā tātou katoa. Ki ngā mana whenua, ko taranaki whānui te Aotearoa, ko Ngāti Toa Rangatira anō nei aku mihi kia koutou. Noku te hana rei, kia haere mai ki te whakanui tēnei huihuinga whakahirihira. Nō reira, ngā manaakitanga ki runga i a tātou katoa, tēnā koutou, tēnā koutou. Huri noa i te whare, tēnā rā tātou katoa. Kia ora everybody. Thank you first off to our komātua toa. Thank you for the welcome. I don't know whether am I supposed to do the emergency notice stuff as well? Have we done that? Have we covered that off? I don't know. It's already covered. Somebody's got that. So don't have any emergencies until I finish talking. I'll try and keep you calm through that period. But what you should know is that this is your place. This is your parliament as Kiwis from Aotearoa. This is a place you should feel at home and should enjoy. And so it's always a real pleasure to welcome people in to the parliament who may or may not have had functions here before. And you'll get the introductions, which mainly involve don't tell anybody, talk to the security guard is the main message, is that I always get from these things, and drop cover and hold if there's an earthquake. But somebody will go through it in more detail than that. I do want to acknowledge also from the outset Professor Jim Mann. Thank you for the invitation that you and others, Heather and others, have facilitated here today. It is a real privilege to be here speaking with you as a former Minister of Health, but hosting as the Member of Parliament for Dunedin, where the University of Otago has a very significant base in the middle, actually, of the finest electorate in the country. I'll share that with you. It's a well-kept secret, not by me. So thank you for the invitation to really celebrate, to mark the occasion for 100 years of insulin. I do want to acknowledge, as I start, my ministerial colleagues, Health Minister Andrew Little and Associate Health Minister Pene Henare, who I know would like to have been here but are unable to attend this afternoon, and they send their apologies and acknowledgements. So this year, 2022, marks 100 years since insulin was first used in the treatment for diabetes. Before then, it was essentially, having diabetes was essentially a death sentence, mostly for children who developed the disease, and sadly we've got no cure yet. But being able to administer insulin to those who are unable to produce their own insulin that 100 years ago was a major medical breakthrough. And it made its way to New Zealand in 1922 and has saved the lives of millions worldwide over the last century. And while looking back at the past 100 years, I know this event will also highlight the new technologies that are available for the management of diabetes and how they can improve the lives of those living with diabetes in New Zealand. I want to acknowledge, of course, all of those in the room who do research in this area, but also those who have families with diabetes or themselves living with diabetes. Each of you who have that experience know only too well the impact that this can have on you and your whānau. Like most New Zealanders, I've got my own story. My grandmother had diabetes, my mother's adoptive mother, and type 1 diabetes, and she was diagnosed when she was 26 years old, and that was just 15 years after the invention of insulin. And so I kind of always have been grateful for the chance to know my grandmother, because otherwise it's very, very unlikely to have ever happened. And I've got such great memories from being a kid, spending time with that grandmother. She was nearly blind by the time I came along as a young kid. But, I got the experience, as my mother had done a lot more than I had, of learning how to measure her insulin as she prepared for her shots. And that impact's something I've always taken with me. My mother spent the latter part of her medical career working on diabetes prevention, and I had the opportunity to focus somewhat on diabetes in my time when I was privileged to be the Minister of Health for 3 years. My grandmother taught me my early budgeting skills. She's not responsible for the bad bits of our household budget, but I used to play shops with her with tea cartons that she'd collected and other packages and old pennies. And so I learnt my early home budgeting skills from my grandmother. So I've got some very fond memories, and just that awareness that without insulin that would never have happened. And those stories, my story is far from unique. There are 25,000 New Zealanders living with type 1 diabetes, more than 200,000 New Zealanders living with type 2 diabetes, and more than 20% of New Zealand's population is estimated to be pre-diabetic. And as you'll know, type 1 is an autoimmune disease. It usually develops at an early age, but can occur at any age. And without insulin and the control over the glucose that it brings, as blood levels rise and fall during the day, there is no other helpful solution about. So the burden and financial cost in New Zealand's health system of diabetes, we know as well, is a significant one. The Economic and Social Cost of Type 2 Diabetes report, commissioned and released by 3 of today's host organisations in 2021, showed the consequences of type 2 diabetes currently costs around $2.1 billion per year, which is nearly 1% of our GDP. Unfortunately, some communities and populations are at greater risk and bear greater burden than others for the impacts of diabetes. Indian, Maori and Pacific populations bear a disproportionate burden, and people who are obese and have poor diet management are also at much greater risk of developing type 2 diabetes. And that disparity clearly points to the work, or that set of disparities points to the work that we need to do. It's important that all New Zealanders with or without risk of diabetes have access to the education, support and resources that will help them or others they're with to manage those risks as best we can. Now, to mark today's significant milestone, the Edgar Diabetes and Obesity Research Centre, EDOR, based at the University of Otago, has joined forces with Healthier Lives, He Oranga Hauora National Science Challenge, Diabetes New Zealand and the Lions New Zealand District 202F to celebrate the millions of lives saved by insulin treatment. And I've had the privilege of being involved in a number of the Edgar Diabetes and Obesity Research Centre events over the nearly 20 years of existence in my role as the local MP over the last 12 years. And I know Sir Ian Edgar, who was a graduate and Chancellor of the university, was a great supporter of the centre and its research. Also a patron of Diabetes New Zealand, a former patron, and I know he would have been very proud to have been here today to celebrate the progress that's been made. And I can easily imagine the broad smile he would have had on. I'm sure as I look around, I can see many others nodding. You can imagine the energy he would have brought to today's event were he here. But I think he'd be very proud of the event that is being hosted. The Healthier Lives He Oranga Hauora, of which Professor Jim Mann is the director, is a national science challenge charged with the work on the prevention and treatment of New Zealand's 4 major non-communicable diseases, one of which is diabetes. Diabetes is one of the 5 core focus areas for the Lions internationally, and District 202F, I'm told, is based in Southland and Central Otago, and they strive to support public awareness and support those living with diabetes financially, helping families with the cost of insulin pumps, supporting diabetes awareness events such as you're doing today. So I just want to acknowledge and thank you for that support in our communities. Now, since the significant medical breakthrough of using insulin to manage diabetes 100 years ago, there have been many improvements in the delivery of insulin and in the measurement of blood glucose. You will all, I'm sure, be familiar with CGM, the continuous glucose monitors, a more recent innovation. They're not cheap, and of course the reason why many people are still living with the traditional tests that we have, but they point to the opportunity for better technologies and also point to the fact we've got more work to do to make sure more people are able to access better technologies and support over time. I am proud of the work the government's done around access to medications in the recent period. In Budget 2022, we invested $20 million over 4 years for diabetes prevention and treatment, focused on Pacific communities in South Auckland, which will help provide Pacific modes of care. This includes an extra 100 training places over 4 years, 100 places to grow additional workforces focused on implementing the Addressing the Burden of Diabetes in Pacific Communities initiative, and helping our Pacific communities to address that challenge that many families and whānau face. Budget 22 also contained the biggest ever increase to Pharmac's medical budget, and there has been, during this particular government, a really significant investment in Pharmac, and I haven't got the statistic in front of me, but the proportion is actually quite significant, and the last investment was the biggest one, an extra $191 million over 2 years to buy more medicines for more New Zealanders, and I expect we'll see more announcements out of that fund over time as they do what they do at Pharmac. As I get closer to the end, I just want to mention the kura and schools nationwide benefiting from the Physical Activity and Nutrition Initiative that I had the privilege of seeing funded and launched in 2020. It's now doubled in size, I'm told, expanding from 300 schools, and it's actually now in 800 schools in 2022. There's the Healthy Lunches in Schools program, delivering 1 million free lunches for kids in schools every week across New Zealand, which is really a key part of the government's tackling of child poverty across New Zealand, which is trending downwards now across all 9 measures that have been set out. These, I think, are important initiatives in the prevention space. And for those that don't know, I'm sure many of you do, public consultation has also opened on a proposal for primary schools to only offer healthy drinks. I mention that because I think you might all want to put a submission in, just to make sure that the right messages come back through, because we know that the schools that have implemented this for themselves have already seen the kinds of results that come out of this program. And it is the job of those consulting to hear what people think and make sure that we replicate the benefits that are well documented, and that could potentially be across all primary schools and for all young people, parents and teachers. And the last thing I kind of wanted to touch on was the investment to provide Maori health workforce training. $39 million has gone into that recently to provide access to training and development to support Maori within the new health system so they can continue to access services better. So, to wrap up, on behalf of all 4 host organisations, I again would like to welcome you here, to let you know that this is your place and you should feel at home as you can with a sticker on your chest. You should feel free to grab any politician that comes past and bend their ear. This is your chance. Do it when you can get it. And welcome you all here to this place for this centenary symposium, not only to celebrate the past 100 years, but to look forward to what might happen in the next 100 years, what's possible as new technologies come onto the market to support those living with diabetes here in Aotearoa, New Zealand, and to make the world better for everybody as a consequence. I, like I'm sure many of you, want a world where my grandchildren, I hope, fingers crossed we're not at that stage yet, get to play shops with any folks in the wider family that develop diabetes, knowing that those people have lived quality lives and have had the opportunities and support in managing their care that we would hope they have, that give them the freedom to live the full lives that we know can be lived with the technologies even available today. Nō reira, tēnā koutou, huri noa i te whare, tēnā rā, tātou katoa. Thank you.